Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back both Kim Downey and Corey Feist. Kim is a physical therapist and physician advocate. Corey is the co-founder of the Dr. Lorna Breen Heroes Foundation. Together, they co-wrote the Kevin MD article, Health Workers Deserve Care Too, How to Protect Their Mental Health. Kim and Corey, welcome to the show.
Thanks, Kevin.
All
Thanks,
right.
Kevin.
So, Kim, how did you and Corey meet?
Sure. So if there's anyone who isn't familiar with me in these spaces, because one of my amazing doctors took his own life and I felt a calling to support doctors. And one thing Corey might not know is my very first, I guess, public presentation of these things was a Kevin MD article, a tribute to my radiologist. And my first podcast ever was, again, a tribute to my radiologist. So Kevin, without planning on it, has followed me in this journey since the very beginning. And about a little over a year ago, I became an ambassador, a very proud ambassador for the Dr. Lorna Breen Heroes Foundation. I have my pin. And this past March, they co-sponsored the Healthcare Worker Wellbeing Day. And I went in person, and my doctor's wife actually came with me. In the morning of the event, I approached Corey, and I think you might have heard my name, but didn't really know me or my story. So I took a few minutes to tell him, and I offered to collaborate in any way I could to expand the message of the Dr. Lorna Breen Heroes Foundation. And he graciously offered to take me up on that. And so I had him on my YouTube channel with Dr. Stephanie Simmons, the Chief Medical Officer for the Dr. Lorna Breen Heroes Foundation. And then I suggested that we collaborate on an article for May, which is Mental Health Awareness Month. And thank you for publishing our article. And that's why we're here today, is to further spread these critical messages.
And Kim, it's just so wonderful to see certainly your growth from that first podcast, and I'm glad that the Kevin MD platform has played a very, very small role into your journey. And of course, now you have your own podcast, and you have your book now. Congratulations on that! And you're such a prominent figure in this physician wellness space. I see you all over LinkedIn, so congratulations, Kim.
Well, thank you very much. And in case Corey doesn't know about our book, it's called White Coats, Courageous Hearts, and it's a compilation with 15 physicians. And Kevin wrote the endorsement, the beautiful endorsement on the back. So thank you. And Kevin, you've actually played a major part. So thank you very much.
So, Corey, I was actually looking back. We last spoke in the fall of 2021. Now, for those who aren't familiar with the Dr. Lorna Breen Heroes Foundation, just tell us a little bit about that, and then how have things gone over the last 4 years since we last spoke?
Yeah, I will summarize the last 4 years as succinctly as I can. Again, it's great to be back with you, and Kim is an amazing ambassador of our foundation. So I came to this party, if you will, in 2021 as then the CEO of the University of Virginia Physicians Group, having spent over 2 decades embedded inside healthcare, first as an attorney and then as a healthcare leader, working and dedicated to the clinicians at the University of Virginia Health System, trying to identify how we could make their day-to-day experience clinically better, how to remove as much administrative burden from their shoulders so they could focus on patient care. In the spring of 2020, my sister-in-law, who is an emergency medicine physician and leader at Columbia, New York Presbyterian Hospital, Columbia University, Dr. Lorna Breen took her life. And she took her life after a very short mental health episode that she'd never had any mental health conditions, but taking care of COVID patients, having been very sick with COVID herself, compromised her. She died on April 26th. On the 27th, the publicity around her death began over our family's objection. And so we were thrust into this national spotlight that we didn't want. And yet we couldn't ignore, because what happened was that we began to hear from thousands and thousands of health workers around the country about their mental health challenges and how they are penalized by the culture and the practices within healthcare just for taking care of themselves, and how they couldn't do that. And so we began the Dr. Lorna Breen Heroes Foundation in the summer of 2020, really focused on this, responding to the feedback that we had heard as a family. Some of that feedback were from the clinicians who I had dedicated my professional career to that time working for at the University of Virginia, who would say things like, if you look at my CV, there's a break and it says a fellowship, but really I needed inpatient hospitalization, and I couldn't risk telling anybody that because it would hurt my career. So Our foundation really began in earnest in the summer of 2020. And since that time, we've been on your podcast, Kevin, but we really are focusing in three main areas. But from an overarching perspective, we are focusing as a foundation on protecting health workers' mental health and well-being by transforming the healthcare industry at the root. Because what we found is that by and large, these are preventable issues that are caused and driven heavily by the day-to-day workplace of healthcare workers. And so we've been attacking this problem through advancing collaboration, getting those different silos in healthcare working together collectively on the workforce as a whole, not just focusing on the doctors or the nurses or the pharmacists but working on this together, because there's so much that we can do together in that. One of the ways we do that is we've got now an ambassador program with over 300 ambassadors like Kim, who've raised their hand to us to say, how can I get involved in this movement? That's another way that we've done this. We've also accelerated solutions. We know that there's been a lot of talk over the last 2 decades, frankly, as this issue around well-being of workers and burnout has really begun to percolate. Things like taking the traditional triple aim of a hospital focused on patient quality, patient access, and affordable care, and adding the quadruple, one more element, the quadruple aim, which is the impact of the work on the workforce. Why hasn't this been really adopted when there have been practices out there for years that have been talking about it? So we've been accelerating those kind of solutions. And then we've also been working to eliminate these penalties that health workers uniquely carry in the United States for just taking care of themselves. And so one of the things that Kim and I have talked about, and we've published in your article, is about this new campaign which we created called All In for Mental Health, which identifies 6 ways that organizations and policymakers need to really embrace and change to support the mental health and well-being of health workers. Because patients have the right to seek mental health care. Health workers do too, but they don't always know it. So that's been a large part of our work. I will just end by saying, and we've become most known for this since I was on your podcast last, we were also in the Oval Office with the President of the United States as he signed the Dr. Lorna Breen Healthcare Provider Protection Act into law. This was the first ever federal law that creates programs to support the mental health and well-being of health workers. That inspired, or that infused over $100 million into the healthcare industry to help create programs to support the workforce. And we're actually working with Congress right now to extend those programs for 5 more years since they've all kind of expired. So we've been really attacking this from a systems perspective, both embedded inside healthcare and also looking at those policy drivers externally that influence and impact the day-to-day experience of health workers. Again, all under this umbrella of really supporting and protecting the mental health and well-being of our workforce by transforming the industry.
So, Corey, of course, I want to talk about this new campaign about the 6 ways
Yeah.
that we could address the
Yeah.
mental health care of the health workforce. But, Kim, I want to get back to you. Obviously, you are an ambassador of the Dr. Lorna Breen Heroes Foundation. Tell us about that experience. Tell us about some of the stories that you could share with us about being an ambassador.
Sure. So I think how I I heard of the organization, but I didn't know how to become an ambassador. And I believe they accept people maybe quarterly, because I remember one day last spring, some of my favorite doctor friends, like Dr. Abda Shabir, Dr. Jillian Rigger, on the same day, I think they had all shared that they were ambassadors for the Dr. Lorna Breen Heroes Foundation. And I was like, oh, wow, I wonder if I could be an ambassador too, because obviously the mission is so close to my heart. So I went on the site, found the form. That's easy to do for anyone here. And I filled it out. And then I, got the acceptance that I was an ambassador, and there's quarterly meetings. And I love being on the call. It's doctors, other healthcare professionals, patients. There's so many people to see them care about these issues and to take steps as to what we can all do next. So that's very empowering to feel like, instead of just talking about it, that there's actually something that you can do. And I'm so very, very impressed with what the organization has been able to do in a relatively short period of time, in which Corey can tell you is And the sad thing is there are intrusive questions on some licenses where for me, I just have to say if I was convicted as a felon of a felony right in the last year as a
Hmm.
physical therapist, but I believe New York had already removed those intrusive questions and Lorna didn't know that, and that, just like kills me to know that. So that's such an important mission, and they have a constant map on the site of the states where they've already been able to remove the intrusive questions.
Hmm.
So to know that I'm involved in an organization that's making a true impact and you can see the difference just fills my heart.
So, Kim, tell us about those calls that you said that you have quarterly with all the different stakeholders when it comes to clinician wellness. What's discussed during call? Take us behind the scenes in terms of some of the issues that come up when you guys all get together.
Well, sometimes if there's something that they want you to promote with your senators, like when the bill or something is up for reauthorization, they tell you step by step what to do, how to do it, and then how you can share it with your audiences. And the wonderful thing is they make it so easy for anyone that within 60 seconds you can click on that button and send out the messages that you want. And if you want to add a little blurb, you can. So just knowing how to do that, and that you're not alone and it doesn't have to feel scary. And sometimes doctors and other people choose to share their stories. Like they know it's a safe and vulnerable place. And there's been times where they'll just share very personal stories. So to be in that space again where, you can talk about anything related to this and it's a safe space and everyone, has the same mission.
So, Corey, you mentioned earlier that there's a campaign specifically addressing the mental wellness of our clinician workforce, 6 ways to help. So, talk more about that.
Let me take you back to 2021, actually, when you and I talked last. One of our ways, as I said, that we're breaking down the silos in healthcare is to get organizations working together across those silos. And we've done that through a coalition which we built called All In Wellbeing First for Healthcare, because we want the well-being of the workforce to come before all of those other things that we ask them to do. And in the Wellbeing First for Healthcare coalition, we have now over 35 national associations and professional organizations spanning physicians, hospitals, nurses, et cetera, et cetera, et cetera. Okay. We spent over a year with that coalition identifying what are the ways that health workers are currently penalized, intentionally or otherwise, by the systems when it comes to just taking care of their own mental health and well-being. And that all-in coalition then developed all in for mental health, which were these 6 discrete actions. So what are those? The first, and we hear this a lot of the through line that I'm about to give you is really around concerns around confidentiality in
Hmm.
different domains. So the very first one is accessible and affordable mental health care, particularly during the time of day that health workers need it, which is generally not 9 to 5 when it is often delivered. And it's also not generally care that they want to have from the institution where they work because they're concerned about confidentiality. So accessible and affordable mental health care is number one. Confidential access to a professional support program or physician's health program, as they're called in some cases. These programs exist. Many people don't know about them. And it's all about, again, that preserving that confidentiality so that the workforce can get taken care of and re-enter the
Hmm.
workplace and continue to take care of patients. So that's number two. The third one is what Kim was just alluding to, equal privacy in mental health care. This was Lorna's biggest concern. Is my license at risk? Are my hospital credentials at risk? Because I'm going to have to fill out a form every couple of years that say, have you been treated for mental health? And I'm worried if I answer yes,
Hmm.
that I'm going to be penalized. So we've that specific action we call our Champions Challenge, where we have a toolkit where organizations are going out and individuals are going out and they're making these changes within the organizations or licensing boards. That one program right now, as I sit here today talking to you, is currently benefiting 1.5 million health workers in the United States because their licensing board or their hospital has made the changes compliant with that equal privacy and mental health care action, which is the third one in the campaign. The fourth one is confidential peer support. We hear from health workers across the country. They say, I actually don't need formal mental health treatment, but I want to talk to somebody who's walked a day in my shoes. I need to make sure that I do that and it's confidential because I'm probably going to talk about things that I don't want other people to hear about. And in some cases, Kevin, that is not necessarily given the confidential protections that you would think it would if you were going to talk to a formal mental health counselor. You're talking to a trained peer supporter in my institution. I'm talking to you about it, Kevin, but somebody might ask you, what did you talk about in your conversation with Corey? And unless there is that formality
Mhm.
around it, you might have to disclose it. The fourth one is something that for me as a non-clinician, I was really surprised at. Healthcare professionals are not always trained and educated on mental health care. And certainly healthcare leaders and in different organizations don't understand what their workforce needs. So education and training on mental health and well-being. And then finally, as I alluded to before, when health workers have to come back into the workplace once they've been treated, we need to have supportive pathways for reentry so that they can seamlessly reintegrate in a supportive way and not be worried about, again, this cultural stigma around getting mental health treatment and this scarlet letter that they might have to wear. So those are the 6 ways. And again, it's all kind of under this concept of patients have the right to mental health care. Health workers do too. And these are 6 different ways that organizations can demonstrate that they really are walking that talk with their workforce.
And Corey, what are some tangible, actionable ways healthcare organizations can begin to implement some of the things that you're talking about?
So I'll go back to the one where we've had the most traction, which is our equal privacy in mental health care. The very first thing that they need to do is they need to take a look at their peer reference forms and their credentialing applications, because those are the first places that organizations have been perpetuating this stigma for years and years and years. And when we talk to health workers, Kevin, the very first thing they're concerned about when it comes to getting mental health treatment is the impact on their job. The second thing they're worried about is the impact on their license. So the very first thing that organizations need to do is join the 600 plus other hospitals in the United States who've gotten our badge. We now have over 10% of the hospitals in the country that have done this work in the last 24 months. Huge progress, huge pace, but that means we got 90% left to go, and we would love everybody to do that. So that's the first one. And then I would direct everyone to this website, which is
Mhm.
allinformentalhealth.org, and look at these different actions that we have listed on the website as how your organization can actually do that. Do you have a peer support program? Have you made sure that it's confidential? Does your organization educate the workforce in mental health training so that particularly healthcare leaders can recognize the signs and symptoms of when a worker is having a mental health challenge and know how to have that conversation in a supportive way? So those are just a few examples, Kevin, but they're all really practical. And I think it's really important as Kim is a great ambassador, we're trying to put out these practical common sense tools to really start to change the landscape for the workforce. And what we hear is when organizations do this, when leaders do this, it can completely change it. I'll pick on one for a second. And this is picking on in a positive way. One organization in the Midwest trained their frontline nurse leaders in suicide prevention. Those nurses didn't necessarily those nurse leaders didn't necessarily have formal training to recognize the signs and symptoms of when an employee or a patient was exhibiting suicidality. Well, in the case that I'm referring to, the frontline nurse leaders were educated, and one of the nurse leaders identified suicidal ideation in one of her nurses on the unit and intervened in the moment. Didn't wait around, intervened in the moment because she'd been trained. That nurse leader are here today.
Mhm.
They're taking care of patients, but that nurse did express to that nurse leader that she intended to divert medicine that day at the end of the shift and take her life that night. And so that is like so powerful, right? And it's simple. A lot of this stuff. It just takes the intentionality using these practical common sense solutions that we're putting out in their All In for Mental Health campaign.
We're talking to Kim Downey and Corey Feist. Kim is a physician advocate and physical therapist. Corey is the co-founder of the Dr. Lorna Breen Heroes Foundation. They wrote the Kevin MD article, Health Workers Deserve Care Too, How to Protect Their Mental Health. Now I'm going to end with asking each of you just to share some take-home messages with the Kevin MD audience. Kim, why don't we start with you?
Sure. I thought I would end with the last paragraph of how we end our article in case there's anyone that hasn't read the article, because we conclude with why it matters. And it's simple. A healthy workforce is essential for safe, compassionate patient care. The current mental health crisis among health workers is contributing to unprecedented burnout rates, staff shortages, and declining patient care. By implementing these 6 actions that Corey just talked about, we can create an environment where health workers feel safe, supported, and empowered to seek the help they need to be at their best, both for themselves and for their patients. Together, we can change the culture of healthcare, we can eliminate the stigma, break down the barriers, and build a system that respects the mental health of those who care for us.
And Corey, we'll end with you.
Join our movement to support the mental health and well-being of health workers at allinformentalhealth.org. We we believe that just as patients deserve and have the right to mental health care, so do to our healthcare workers. Join the movement today. Reach out with any questions you have. Support the mental health and well-being of all of our health workers so we have a thriving healthcare delivery system in the United States.
Kim and Corey, thank you so much for sharing your perspective and insight, and thanks again for coming back on the show.
Thanks for having us, Kevin.
Thanks, Kevin.